As introduced, my name is Samuel Donyamonda. I am the editorial assistant at the Journal of Kenya Association of Physicians. I want today a topic we go through the introduction to data management. I want first of all to outline the objectives of our topic. The first objective is understanding the variables and the types. The second objective is introduction to types of analysis. And the third objective is resources for utilizing the research tools, that is the SPSS. First of all, allow me to introduce to the introduction to the types of variables. First of all, you are supposed to understand what a variable is before we move on. First of to the introduction, to understanding what a variable is that a variable is any characteristic or number or altitude that can be measured, observed, or changed in a research. The key characteristics or the key points about a variable is that they represent data we collect. For example, we can talk of age, weight, height, the body mass, and the etc. The other characteristic of a variable is that they can take different values. That is from starting with they can be male or female or other genders. They can be either age, that is from 12, for example, 12, 22, 33, etc. Also, we say that another characteristic of a variable is that a variable are central to research. That means that the variables help researchers to ask questions, test hypotheses, and measure the outcomes. That's the definition of a variable, especially in the field of research. Therefore, let me go directly to what I have shown here is just a graphic of flow of how variables find themselves in the research. That, for example, when you get a research question, let's say, for example, you are trying to get a research question on a certain drug that you are trying to analyze its effect, let's say metformin effect on patients. So first of all, you have to identify your variables. For example, you after the identifiers falls under the patient, that is the patient. Therefore, you go to find the variables that, for example, age, for example, the gender, and others. So there we come into when you get those variables, you just have to specify them. Either they fall under independent variables and others. So as we'll observe in the next, as we are moving on. And that's how now the variables will help us in testing of hypotheses and other things. Let me get to the types of variables. The variables are grouped in three ways. The variables can be categorized, that is in role in research, measurement skill that mostly applies in statistics, and type of data. Let me go directly to the roles in statistics. That is our first categorization of a variable. First of all, roles in statistics is that the first categorization is under the independent variable. What is an independent variable? The independent variable in research under the research, based on research, is that the researcher is a variable that the researcher manipulates or categorizes to observe its effects. Also independent variable can be called a predictor, exposure, a cause, or an explanatory variable. Let's say, for example, taking a randomized controlled trial is conducted to evaluate the effect of metformin dosage on a blood sugar control in a patient with type 2 diabetes. What is the independent variable in this case? The independent variable in this case is the metformin dose level. Let's say, for example, 500 milligram, 1,000 or 1,500 milligram daily. This is our cause. This is the explanatory variable. This is developed the base of our of the research that is under the dependent variable. So this is the predictor of what the researcher wants to evaluate. Secondly, we have the independent variables. The independent variables, these are the outcome being measured in the study that is influenced by independent variable, also called outcome, response, effect, or criterion variable. Example, a randomized control trial, that is the example that we had used previously on the independent. A randomized controlled trial is conducted to evaluate the effect of metformin dosage on blood sugar control patients with type 2 diabetes. We want to check what is the independent variable in this case. The independent variable in this case is the change in patient fasting blood sugar, glucose levels after 12 days. Let's say, for example, when the patient now visits the clinic, that after you have been subjected to the metformin dosage, there are those blood sugar control levels that are tested after, let's say, for a certain days or a week, a month, etc. So the records that are recorded for the blood sugar, that falls now under the dependent variable. That's what we say now. The dependent variable is the change in patient fasting blood sugars. For example, maybe after the patient was subjected to metformin dosage, the sugar may have rised or gone down. So that's where now we say that the changes in the blood sugars now falls under the dependent variable. That's the reason we say the responses of the drug that the patient have been subjected to. Secondly, in the third type of variable and based on research is control variables. A control variable is a variable that are kept constant to prevent them from affecting the outcome. Let's say, example, each of our participant, e.g., the participant who are in a certain, let's say, who are participating in this metformin dosage evaluation, we say the patient may fall under 30 years, 40, 60, etc., moving onwards. The baseline HbA1c, HbA1c levels, e.g., for example, let's say, the baseline, for example, when the patient visited the clinic, the first day, what was the level of HbA1c? Let's say it was 7 or a range of 7 to 10 or etc. So that is at the recruitment moment. Also, that one falls under the control variables. So we can also talk of the dietary intake of the patient. Let's say, for example, patients are given the plan. That also falls under the control variables. Also, you have the physical activity levels of the patient who is under the examination, that is under the metformin dosage examination. Also, patient can be advised to maintain routine exercises. Also, the physical activity levels falls under the control variables. Also, you have the excluding those taking insulin or other oral hypoglycemics, the drugs. Also, that one also that is concomitant medications. Also, they fall under the control variables. So we go to the confounding variables. What are the confounding variables? The confounding variables are the variables that possibly influences the independent variable or the dependent variable. Let's say the dietary adherence of the patient who is healthier may both respond better to metformin or have a lower HbA1c. Also, exercise levels, that is the physical activity, depending on the drug dosage, we reduce the HbA1c also. Also, you have the obesity, that is the BMI. Higher body weight may affect drug metabolism and the glycemic outcomes. Also, you have the genetic factors of the patient. We have also other factors these other factors that may fall under the confounding variables. Why do we say that confounders matter? If not controlled, these factors can link to the mistaken impression that HbA1c reduction is due to metformin, when in fact it's partially due to diet, exercise, or other medications. Let me go now to the measurement scale. Under the measurement scale, we have two main categories. We have the categorical stroke, also can be called qualitative variables, and also we have the numerical or quantitative variables. Under the categorical variables, we say that these are the variables that represent qualities, attributes, or categories rather than numerical quantities. This can be divided in two. Under the categorical variables can be divided in two. First of all, that is under nominal and the ordinal. For example, when you go to data analysis, especially in SPSS, under the measure, you'll find a place where you are supposed to categorize the measure of the of the data that you have keyed in SPSS. For example, it will fall under nominal or under ordinal. That's now this is falls are very important. Forms are very important topic, especially when you are doing a data analysis in SPSS. Under nominal, this we say that these categories categorizes without ranking. Let's say, for example, in metformin standard that we have shown in the case that I have demonstrated earlier, we find that there are treatment groups, that is the metformin, those who are under metformin are the ones who are under placebo. That is a drug that's not so much effective as the one you are trying, that is the control drug, that is the placebo. So in go also there also gender will fall under nominal, that is male or female. The marital status of patient, also you can reckon single, married, or divorced, or the other gender. Also you have the presence of the commodity, also yes or no, you can reckon that one. So all this one will fall under the nominal, that is under the nominal. That means the categories without ranking, either male or female, no ranking is required in nominal. Let's go to ordinal. In ordinal, with order or ranking. In ordinal, you have to provide an order or a ranking. That means that categories have meaningful sequences, but the spacing between categories is not equal. Let's say, for example, the case we have talked about the metformin, that example I have provided. We want to talk about the severity of the diabetes. How is it? Is it mild, moderate, or severe? We want to talk on medication adherence rating. For example, how are the patient adhering to the medication that he has been subjected to? That is the metformin. Is it the adherence is low, medium, or high? How about the patient satisfaction? When the patient visit the clinic, how are they satisfied? Are they having unsatisfied, neutral, or satisfied? All these one falls on ordinal. When you go to SPSS and you are required, when you enter your data, especially when you have a data that is redundant, I think anytime when at the measure when they request for the measure, then for example you are mild, moderate, or severe, that place you'll have to insert an ordinal. That means it falls. That means the data falls under ordinal. That is redundant. Let's go next to the numerical or quantitative. We say that our numerical or quantitative data, these are variables. These are variables that can be measured, expressed in numbers. They show how much and how many or how often. Under the numerical or quantitative variables, they are grouped into two. First of all, you have the discrete variables, and second, we have the continuous variables. Under the discrete variables, we have the whole numbers only. That is, which means that cannot take fractions variable. Let's say, for example, number of tablets a patient has taken. Let's say that is, for example, the case they have given of the metformin. Number of tablets that the patient have taken per day. That falls under the discrete variable. Number of clinical visits that the patient have done, for example, during the control process. We have also the number of reported side effects of the patient, or this falls under the discrete variable. This because this one cannot be placed under, cannot have a decimal. For example, of the number of visits, you can say that a patient have visited 1.5 visits. That cannot be possible. That's the reason this one falls under the whole number, that is the discrete variables. Next, we have the continuous variable. We say that can take any value within a range, including fractions and decimals, more precise than discrete variables. So this one, they can take also, this can take fractions or decimals. For example, let's say the level of HB1C, that is under the case I have given earlier of metformin. So when you measure the response of the metformin to the patient, for example, when he comes for the first day after he was subjected to the drug, he can come for the second visit. You can measure, you can see that it's, for example, let's say 8.5. The next time it can be 9.5. Other time that way onwards, etc. So that one will fall under that one will be provided as a continuous variable. When you go to the fasting blood glucose, also the same. The patient's weight also will fall under the continuous variable. Let's say the patient may weigh 80 kgs, 0.5, 80 kgs, 0.9, etc. What about the age of the patient? Also, the age of the patient falls under continuous variable. Let's say, for example, you can say the patient is 10 years and a half, or that is 6 months, etc. So all that falls under the continuous variable. Let's go to the next our next topic, that is the analysis. What are analysis? First of all, allow me to introduce you to analysis. Analysis is the second step after you have collected your data. When you have gone to, let's say, for example, you have gone to a clinic, you want them to study, like, for example, the case I've given the response of a patient on who have been exposed to metformin. So their responses, after you have collected all that data, you have collected the age of the patient, you have collected the gender, you have collected the HbA1c responses, and all those data that you require. Then you come to the second step after that, after you have recorded your data, let's say, for example, in a spreadsheet, that is the Excel, you have recorded them, maybe, for example, as a questionnaire, or you have also recorded them in the SPSS. The next step that comes in now is introduction to analysis. That is the next step after collecting data. So when we talk of analysis, this is now the breaking down of the data that you have collected, so that you can understand more about the data that you have collected. This data, you have to look at the age, you want to look at the gender, you want to look about on the spread of the time series and other things that you want to observe on this data. First of all, in analysis, there are many analyses that can be done in a data. But so allow me to introduce you to the analysis that are the analysis that are most important, especially in research. First of all, allow me to introduce to descriptive analysis. We say that descriptive analysis summarizes and presents data in a meaningful way. For example, the data you have collected, let's say, for example, you have collected data on metformin response of a patient, that is who have been diagnosed with type 2 diabetes. So you have collected the data of the gender, you have collected, you have gender variable, you have HbA1c variable, you have age variable. Let's take those three variables. So you are supposed to summarize them. Summarizing this one, now we say that they fall under descriptive analysis. That's where now you want to summarize this data and observe. So that way we say that descriptive analysis tells us what the data shows that how the data is without making predictions or testing hypotheses. For example, you can tell the mean of the patients. You can tell the percentage. For example, you can say that 50% of the female who attended this exercise, you can say 50% is female. You can say 40% is male and 10% others. You can say also, through the descriptive analysis, you can also draw a graph also to show. You can draw a bar chart, an histogram, or a pie chart. All these ones also falls. All these ones falls under descriptive analysis. Also, you can want to summarize the age. You can say, for example, the age group of the people who came for the standard maybe falls under 70 to 60. For example, that one you can show, you can show it in a bar graph. Others also you can show them on histograms and so on and so forth. So we have seen that descriptive analysis summarizes. You're doing the summary of the data that you have collected from the case that you have shown earlier. Let's go second to inferential analysis. We say that the inferential analysis uses sample data to make conclusions or generalization about population. Let's say, for example, the data you have collected, you'll have to what mostly the inferential analysis does, it tests the hypothesis, finds the relationship, and predicts the outcome. For example, this can be done using the test, the t-test, that is, it can be done using the ANOVA, the chi-square test, and the regression analysis. When talk of the t-test, if this is a test that can be found, that can be done between two groups. For example, there's a when we are doing the case on the metformin, we find that there are some patients, let's say, who have been subjected to metformin, and also we have the control, that the placebo. So we want to test and compare. We want to test and compare these two patients, these two control, the metformin and the placebo. Therein, you'll bring in the test, the t-test, to compare these two. Let's say, for example, ANOVA, to compare, we say in ANOVA, this compares more than two dosages. Let's say, for example, we have the patient who have been exposed to 500, 100, and 1500. So this one, when you want to share, when you want to get the comparison between these one, so we'll have to apply what we call ANOVA. Let's go to chi-square test. Chi-square test is also another type of inferential analysis that also tries to find the association between the categorical variables. Let's say, for example, the gender and the adherence. For example, when you find the chi-square, you might find that the female are the ones who are so much adhering to the instructions that have been given, and you find that male are not adhering. So when you want to check that, you just apply chi-square test, which falls under the inferential analysis. Next, we go to regression analysis. A regression analysis predicts the effect of dosage of the dosage. For example, you want to know more about when you want to tell more about the HB1C, what are the effects of HB1C, you just have to apply the regression analysis. We want to predict something, maybe in future. How will be the future people who will be subjected to the same drug will be affected with it? Just apply a regression analysis and just get to know how the future will look like. Let's go to explanatory analysis. Explanatory analysis looks for patterns, trends, or relationship in data without strict hypothesis. Let's say, for example, the correlation. For example, a correlation between weight loss and HB1C improvement. You want to check the patterns, the relationship. Also, you apply in the explanatory analysis. We have also cluster analysis from groups, that's patient by response to metformin. Also, that one, you can also apply the explanatory analysis. We have the predictive or modeling. In statistics, we have this one, we have the predictive analysis. This usually uses the statistical machine learning to get the model or to model an equation. For example, this example I'm providing here using a patient baseline data. Let's say that, for example, the baseline data, that is the first day test of the patient who have been subjected to metformin, for example, was 5. That is 5.0. So you can, after recording the baseline, you can now predict that one. You can now subject it to an equation that have been provided in the predictive analysis, where you can predict the likelihood of a good response and other things. This one also helps in predicting also other outcomes that may happen, especially to people who have been exposed, let's say for the case that I have provided. Let's go next to this table I have provided here. I'm trying to show the characteristics and how most of the variables falls in the data analysis. Like, first of all, we have the variable type. Let's say we have the example of a trial and how the analysis that can be used. Let's say, for example, you have a nominal, which is false and qualitative no wonder we get, like, for example, the treatment group, that is metformin versus placebo, gender, male or female, others. This one now we have to do the frequencies and percentages. Chi-square, we can check on association. We have a logistic regression, that is to check, for example, if the dependent variable is binary, e.g., also you can use that one and check. So you have the ordinal, that is under the qualitative ordinal. Let's say, for example, diabetes in a severity, that is mild, moderate, or severe. Also, we can apply median, mode. You can use the Mann-Whitney U test, that is for tumors. If they are more than 3 groups, you can use the Kruskal-Willis test and the Spearman-Strand correlation. We have the interval qualitative, that is equal spacing, not true 0. Also patient satisfaction, that is, also you can find the mean. We have the standard deviation, t-test, turnover, and correlation. And the other, we have the ratio that falls under qualitative. Also, let's say, for example, the HbA1c, fasting blood glucose, weight, kg, age. Also, this one you can find the mean, standard deviation range, t-test, turnover, regression analysis, and correlation. So let's get to SPSS. SPSS is one of the tools that are mostly used in data analysis, especially in clinical trial, in clinical data that have been collected. Let's say, for example, the data we have collected on metformin. The case I'm provided on metformin. When you collect the data, you can just open your SPSS and key in data. Most people may ask how, most people can teach themselves on how to do data analysis using SPSS, because SPSS is one of the simplest applications that can analyze data easily without any complexity. First of all, to know more about SPSS, you can just access this UMBC Research Commons that gives the introduction to SPSS. I think the tutorials there, they can guide you on how to get your SPSS. You pay for the subscription, and also, or you can get a SPSS that already track, which is I think that is a piracy, though it's not encouraged. But also, when you go there, you'll know how to download the SPSS, pay for the subscription, and many other things. Also, the linear statistics, that is the SPSS step-by-step guidance, also that one guides the students on how to learn SPSS and also all the steps that are required in SPSS. Also, you have the UCLA. Also, you have the TAFS Data Lab. Also, that one provides resources for data for learning SPSS. We have the SPSS tutorials. Also, that.com also provides. Also, you have these books. These books also provide help in discovering in studying SPSS. We have the discovering statistics using IBM SPSS. That is by Andy Field. Also, we have the statistics using SPSS and integrative approach. Also, this one is a book by a statistician from the United States. Also, you can check that one, and also you can be able to learn more about the statistics.